So I'm going to just get Marin adjusted. She's really, as you guys all know, physically active, right? So she was just telling me she works out a lot, and that does, leave her a little bit, sore, sometimes with aches and pains, and she definitely understands the importance of spinal health, okay? Real quickly, the reason why chiropractic care is because it holds your your spine holds your nervous system. So brain turns into spinal cord, runs down the spine, nerve roots branch off of the spinal cord. They do that going through the spine. And so if you have joints that are fixated, if you have painful turning and bending, if you got muscle tension, chances are there could be something going on at that spinal level, at that spinal joint level, that's affecting that nerve root. And at that point, communication through that nerve root from the body to the brain, and then from the brain to the body will be interfered with. And so when we're talking about the importance of spinal health, really chiropractors are one of the only doctors that essentially floss the spine, if you will. Of course, we all know about flossing our teeth. It's so important because you can see it. Well, it's important to floss your spinal joints. And so that's chiropractic care, and that's why, and I think that's probably a realization that Marin came to a while ago as she was, just going through this journey of health and life. So when I'm adjusting somebody, I'm always checking alignment, checking leg length, checking the hips. Is there rotation? Let's see, I think, and then we're always going to check the spine, and I'm basically palpating the spine, and I definitely want there to be a bit of a spring. The spinal joint should bend and flex on themselves, and when you get to an area that is a little bit stuck, then that's a point of spinal fixation, and that's where the chiropractic adjustment would come in. And so once I've kind of found a few areas that I think need attention, in my office I like to do a little bit of tissue work. I have this massager that I use, and I might massage a muscle group that feels a little bit tighter, and it's just a great way to get the body ready for an adjustment. Usually allows the patient to relax. I usually do this for a few minutes and just allow them to take a few deep breaths and get ready to be adjusted. Sometimes I've heard where you'll go into a chiropractic office and you lay down on their table, and then they just crack you right away, and they end up a little bit sore afterwards, and I feel that is because the body wasn't whatever, maybe they just got out of traffic, and then they were a little bit late to their appointment, and they laid right down on the table, and so you want to give your body a chance to at least accept the adjustment. And so I like to do this tissue work, and usually it just feels good. Sometimes they purr. No, I'm joking. And so once I've kind of loosened up the areas that I feel needed to be loosened up, there's all sorts of different adjusting techniques, from manual to instrument adjustments to drop table adjustments. I like to use this instrument adjustment. This is called an arthrostem. It delivers a repetitive tap. There's something about that input, this repetitive tapping motion is sensory input. So the proprioceptors, mechanoreceptors, and the spinal joints pick this up. It's sensory input to the brain, and it helps override pain and dysfunction signals. Again, we're just literally pushing reset here on the nervous system. Sometimes if I'm working with people that are maybe elderly or even infants to toddlers, it's not going to be my ultimate goal to manually adjust them, but I still want to get some nervous system input, and so I will use this instrument, and we can still get great changes in the nervous system and how they feel, even range of motion, and we don't have to crack them. Some people are afraid of the cracking sound, or they don't want to be manually adjusted, and that's where an instrument adjustment comes in very useful. So then at that point, we can start doing some adjustments. Marin, why don't you lay on this side? Okay. And I'm sure you guys have seen enough videos where you've probably seen the chiropractic adjustment. And this is would be the low back lumbar adjustment. Here, go ahead, take a breath. Okay, good. And lay on the other side. And usually, you know, just a, you know, easy applied force. Take a breath. There we go. Good. Lay on your back. So that's how we adjust the low back, the lumbar spine. Now I want you to go ahead and give your shoulders a hug. Scoot you down just a notch. I get my hand under her back and take a breath. Okay. Okay. Okay, good. And then there were some points in her neck that I wanted to check. So you're going to just let your head relax here. Okay. So let your head relax and I'll move it for you. So there's a little bit of a fixation right here. So it's going to be real easy. Give you a little bit of a bend. Okay. And then just right there. Okay. All right, good. Let's go ahead and stand you up. Stand here. I want to check your posture. Just shake it out a little bit and whatever seems like a normal stance. And of course, Marin has great posture. I think a lot of that has to do, you know, with her yoga practice, with her floor sleeping. and that would be an adjustment here at our office at Malama Chiropractic. All right, go.
Thank you.
Yeah.